All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. Thank you all for being here, present early and up and at 'em here at Health Plan Markets. We really appreciate you being on these calls. And as a quick note, I know we're in the middle of annual enrollment period, and then we're going to be overlapped with open enrollment period for ACA. So just keep in mind that these calls are being recorded on YouTube and hosted there. So in case you miss one because you have client appointments, we totally understand. Just make sure that you're subscribing and setting your notifications so when we upload the latest call, you're not left in the dark on what's going on out there as we move forward throughout the rest of the year. So thank you guys for being here. Our mission here at Health Plan Markets is to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. Thank you for doing what you do every day. So as we normally begin, we've got to keep one foot in the classroom and the other one in the field at all times. So I am going to go ahead and switch over to
He's
our
on, isn't he?
training.
Isn't that him?
Yeah.
Huh.
Okay, we got it unmuted there. All right, so let's move over to our training calendar. And as a reminder, guys, what I'm sharing with you right now is HQ. So if you don't have HQ, please reach out to support@askhpm.com so you can get your HQ set up and ready to rock. So on the left-hand side, you're going to see learning here. So you're going to click learning, and the training calendar is under learning. So all the trainings that I discuss on this call live on your HQ, and it's loaded up in a month view here, and the day that you're looking at is highlighted and then moving forward. So not a lot of trainings this week, just keep that in mind. We are in the middle of season, so we don't expect to see a lot of trainings here, but there are a few that I wanted to point out. So the first one is for tomorrow. We've got AvMed doing their open enrollment training for ACA. So keep that in mind. If you are going out there and doing ACA trainings, AvMed is the way to go. They've got some new stuff coming up for 2025. Moving over to Wednesday, you've got our very own Al Clancy for his virtual office and chat from 9:30 to 10:30 every Wednesday. So if you find yourself in a jam, if you need help, Al's the guy to reach out to as your coach there. We also have our contracting department available from 11 to 12. So it's open forum questions and answers. If you have any issues or questions about contracting, you can reach out to them. They've got an open door every Wednesday at 11. Moving over to Thursday, this one is one to highlight. Our partner, Daniel Franco of All In Insurance, is going to give us an in-person ACA training. He is our number one producer for ACA, and he's going to show you all the tips and tricks. So if you're in the Orlando area and you want to stop by, this is the way to do it. It's at 10:30 on Thursday over at his office at East Colonial Drive. So he's doing a free ACA training. Whether you've been in the business for a while or just getting started, he has some great knowledge as far as how the business operates. So if you're interested in attending, just RSVP by calling our 844-696-3975. We'll be hosting some virtual trainings in the future, so just keep that in the back of your mind. But if you are in the Orlando market and you want an in-person training, that's the one to go to. HQ training is every Thursday at 3:00, so you can jump on that, and that is hosted by Gabe. So he will give you the walkthrough on HQ. We're going to make some significant updates as far as what's going on out there, and adding some new features. So if you do have some suggestions on how to improve HQ, please let us know. And then lastly, at 9:30 on Friday, we've got Tom Ryan and his What About HPM Shop. So this is the updated version for 2025. He'll go through all of the things that you might be wondering, what changed about HPM Shop, or, what's going on, or where does this live now? Really great opportunity to check that out. So that's the training for the week. Remember, you got to keep one foot in the classroom and the other one in the field at all times. Getting a lot of questions about the AEP contest. So under resources, I want to share with everybody from your HQ page, you can go under resources, and we've got our AEP Survival Kit 2025. And this is some key information. We've got some updates on the Spark platform, some new webinars, and then our AEP 2025 contest. So those of you that were at the kickoff, learn that we are going to either one of three places, depending on where the top agent selects, either Cartagena, Costa Rica, or Dominican Republic. And so the full contest details are in this video. All the overview and the rules are here, how the points work, and we've got an updated list of all of the points in which each carrier, how many points that they get for each sale. Now, one thing that's missing that's coming soon is there's certain carriers that are not listed on HPM Shop. It was a carrier decision on that, so we are going to have you manually track certain carriers for the contest. And so, for instance, Solis is one of those carriers that's not on HPM Shop. We will have a button here that says manually track, and then you'll be responsible for tracking those applications. Okay. As we get through the first week, it hasn't even been a full week yet for AEP. We're going to go ahead and start updating the leaderboard, and you can check to see where you land as far as where you are in the leaderboard. And for those folks that actually made the contest, they will be listed here on the top here. So that is where the contest lives, and I want to ensure that everybody knows how to get to that. And again, from the homepage, it's down under resources, and you'll click AEP Survival Kit, and you'll see it there on the right-hand side. Okay, there we go. Now, talking about HPM Shop, I want to acknowledge the fact that under HPM Shop, there's been a lot of changes, and a lot of the information is getting uploaded for 2025. We know that not all the providers are accurately listed inside Shop. We know that there's errors. We know that there's plan information that's incorrect. We know that there's problems with it. And this is typical every year for the first week or so as you guys start to dive in and start using the platform. So what we're asking is if you spot an error or if you see something that's wrong, please take a screenshot of the error, or if you know how to do a video to show how it's erroring out or whatever's wrong, or if you want to talk over it, that's fine. And you're going to send that over to support@askhpm.com. Okay, very easy. Just email support@askhpm.com, and we'll make sure that we've got somebody there to take a look at it and ensure that all of that is going to be up to date. Okay. It does take time for all of these requests to be fixed. Sometimes the request is carrier data issues, which means that, for instance, if Humana mistakenly sent us the wrong data for Connecture, that it has to go back to Humana for the correct information. It has to be reviewed and then sent back down to the data team to build it back out. So these requests are not going to happen immediately. It's just a process, but the sooner you let us know that you spotted an issue or something's broken or it doesn't look right, please send it on over to us. Those of you that have not yet logged into your HPM Shop 2025, just know that the first time that you log in, it may say that it's not October 15th. What you'll need to do is you'll need to clear your cookies on your browser. And if you don't know how to do that, please, you can Google it. It'll show you how to do it. Or you can reach out to our team and we'll walk you through on how to clear your cookies and cache in your web browser. And that's for those folks that have written in 2024, used HPM Shop in 2024, and are now using HPM Shop for 2025. So if that's you and you haven't yet logged in, you might see an error there. Just clear your cookies, clear your cache on that particular browser, and it should work fine. So again, if you spot errors, please reach out to us at support@askhpm.com. We are aware that there are several issues, and we're going to do our best to address those issues as they come in. Okay. All right. So we have a couple of other announcements. The other thing on Shop I just want to make, or on HQ, that I want to make sure that everybody's aware of, is we again, we don't want to overload your email box with a bunch of updates. So what we're going to be doing is posting updates here on HQ right on the front page. So, special events or special information that we think is going to be useful for you, we're going to be posting right here on the front page of HQ. So that way you don't miss it in between these Monday calls. Okay. So just check back every so often, and we will make sure that we put the latest updates there for you to know what's going on. Some updates as far as some opportunities. We were informed last week that the state of Florida, the college systems, are going to be dropping Medicare eligibles off of their group plans. And so many of those folks are going to be looking for Medicare plans this season. So everything from community colleges to universities across the state, if they are state funded, we have learned that that particular health insurance option will not be available for retirees. So there's a huge opportunity for you guys to go out to the schools and talk to the administration there and let them know that you have a solution for their members that are looking for health insurance for 2025. So this is the perfect time for you to go out and do that. Go into the schools, meet the people, and let them know what you do. That's the only way you're going to make your phone ring. So that's a huge opportunity. If you've got a community college nearby, if you've got a state college nearby, it's a great opportunity for you to go in and introduce yourself and let them know how you can help them, especially those retirees that are coming up. Okay. So that's what's going on. That's one big opportunity that you have out there. Please keep in mind that there are several plan terminations, and there are certain plans that are dropping benefits. And if you haven't reviewed that yet, if you haven't met with anyone from our team and you feel lost or you're really not sure, what's going on out there, I would say join one of our coffee and chats with Al. I think that he has a good understanding on, which plans need to be ready to go. And so we'll go from there. It's really important that you're checking your emails from the carriers. Please make sure that you're keeping up with that. Again, we're not going to send you emails. We're going to post them right here in HQ. So that way, if there's something very, very important for you to know about from HPM, it's going to live right on the HQ page. Okay. All right. With that, looks like Brian's trying to get in. And Nick, just so you know, the meeting's unlocked, so there really shouldn't be an issue with anybody getting in. So we do have Centerwell. Brian, he's trying to join us here. So as soon as he's ready, we'll let him take over. But I do want to make a quick last announcement as far as this call. So we are going to go away from Ring Central for our webinars, and we're moving into a new system, which we're going to be checking on and testing out in the next couple of weeks. So the one email, phone call, and everything that you're going to get from us is the new meeting coordinates for this particular call. We're going to be moving to a new system that should be a little bit easier to use for everybody, a little bit more seamless, and just more user friendly altogether. So we'll make that announcement shortly. But for now, it's business as usual. We'll meet you back here at these call coordinates on Ring Central. But just know that a new system is coming before the end of the year. We should have it launched before December 1st. So we'll send you out new call coordinates, and then you'll just need to bookmark those moving forward from there. So with that, do we have Brian from Centerwell joined us? And Nick, you might need to have him call in if you can help him out, or maybe you can sync and link him in. All right, I got a thumbs up, so they're working on that. So feel free to interrupt me once he's on, Nick, and then we'll go from there. In the meantime, marketing. I want to talk to you guys about the marketing process. Several of you are doing events out in the community. So if you are doing events out in the community, we need to know about it. And it's for compliance purposes in case you get secret shopped or somebody, is saying that you're doing something wrong. If we don't know about these events, then we can't help you. So going back to HQ, I want to share with you again, if you're doing events or you plan on doing events, it's a very simple process. You're going to go over to the marketing side.
Hey, Justin, I'm sorry. He said he's waiting to be let in.
Yeah, I don't know what that means because this meeting is unlocked. So there's no everyone can come in. So maybe have him call in.
Looking on the Google Meets meeting.
He may be on the Google Meets meeting. Yes, he's on the wrong meeting. All right. So over on the left-hand side under Meet Marketing, you're going to see Event Request Form, and you're going to click that, and it's going to open up a new page. And on there, you're going to see the Sales and Marketing Reporting Form. So if you're doing events, we need to know what's going on with your events. I know this may be a little kind of a big lift per event. The thing is we need to know the details in order to help you with this event, how we can, make sure that you have supplies there. If you need tents, tables, tablecloths, giveaways, kits, whatever it is, projectors, whatever you're doing, if we don't have it on the sheet, it's going to make it really difficult for us to communicate and get those things for you. And then CMS, if they come to us and ask us, hey, what events are out there and we don't know, this could be a big red flag. The other part of it is if you're looking for marketing materials related to this event, if you need flyers, postcards, whatever the case might be, you're going to need to submit through the event form because we're not going to be able to make you anything unless we know about it. So that is on the marketing events. And then if you're looking at our catalog, also under marketing, we have a catalog that's built out with some pre-approved templated pieces that you can use to get your marketing going. So just a couple of features I wanted to remind you guys about in HQ. It's all there. And so making it easy for you to do your business. So do we have Brian yet? I still haven't figured it out. Oh, here he is.
No, Justin, I'm here.
All right.
Still haven't figured it out. I went to the Google one, my friend. I went to
know.
Google Meet.
We did that to make sure you were paying attention. So
Really?
yeah.
Well, I think I failed miserably, Justin.
No, you did good. You did good. Well, guys, let me quickly introduce Brian Clemens of Centerwell. He is here to give you the good news and what you need to know about Centerwell going into 2025. So, Brian, take it away, buddy.
Thanks, Justin. Appreciate you. Appreciate your whole group. I constantly hear from Sergio and from Nick, and I don't see you as much as I used to, but maybe we'll change that this year. So, yeah, absolutely. So, and your group has been fantastic to work with. We just got kind of hooked up with Rizwana Khan and her group last week. So we're continuing to do outreach to your organization. So I can't thank you enough. And hopefully AEP is off to a banging start because it feels that way on our side. So hopefully that's permeating through your organization as well. All we really wanted to talk about is just different options at Centerwell. Other than, all the other provider groups can come in. We can talk about senior care, and we can talk about our physicians. We can talk about our locations. I'm going to talk about what makes Centerwell different, and actually kind of how the marketplace has changed considerably in the last few months and how it is continuing to evolve into 2025. Centerwell is one of the few, if only, MSOs that is growing in this environment right now. We just acquired 7 of the Walmart health centers. I've heard rumors that there's another acquisition in the works right now. So we're expanding as we go. We're currently, when you throw in the Walmart health centers, which are not fully staffed, by the way. First question, Justin, whenever I bring this up is, hey, are you going to allow us to tabletop? We don't even have the doctors or the staff hired yet. So those decisions will come later, and I promise we'll plug in with HPM when those decisions are made. However, that's one of the reasons, or one of the things that makes us different from the other provider groups that are in the kind of in the universe right now in Central Florida. Another thing that's different, everything we do is senior focused, from our exam beds to our times, our appointment times. Your seniors, your clients can expect a 40-minute initial visit, and all the subsequent visits. We block 40 minutes every time for the patients when they come in. Our doctors average between 12 to 15 patients a day. And that is specifically because seniors' requirements and what's going on and with the different modalities that they're dealing with, they need more time than being thrown into a 5 or a 10-minute office visit. Now, yeah, if it's just a prescription fill or something like that, yeah, maybe it'll be a quick turnaround, but we block the time to make sure that your clients are taken care of. And so as we roll into AEP, as you bring in some T65s in, you can be assured that in our clinics, they're going to get a minimum of a 40-minute visit, as well as they'll be contacted to do like an onboarding visit where they can come see the facilities, meet the administration, tour the facility, and potentially see the doctor before their first visit. So those are all things I think that kind of distinguish us from some of the other provider groups that are out in the universe. I specifically have a team of about, right now we're a little shorthanded. So if you guys know any marketing people that want to work with, I have about 10 right now. We're going to be looking to hire another marketing another marketing person here in Central Florida. We're specifically trying to look for Seminole and Lake County, but our people can help you build your business. So our community engagement professionals, the entire message, if there's one thing you take away from me blathering on, it should be this: we want to help you build your book, and then we want to help you maintain your book. When you park them in a Centerwell clinic, there's not going to be a broker tabletopping in front of our clinic, in our clinic, ever. Since I took this position from the position I was in before, I was starting to do it at the old place I was at. I'm doing it at this place. No brokers inside of our facilities trying to pluck off your business. Once you trust us with your client, we want to keep that trust and keep that relationship. So there will be no broker, no W-2 agent in our clinic. But if you need help building your book, that's where our community engagement professionals come in, where they go out into senior communities, do senior health fairs, you name it. Sometimes we'll even do activities at coffee shops. We'll do activities in senior communities where we're doing diabetes education or things like that. That's where we want to help you bring new clients in, and then hopefully you see us as a good business partner and feel comfortable putting those new members in a Centerwell clinic where you know they'll be taken care of with all of their medical needs, but also that your book will be protected once they come into a Centerwell clinic. So those are just some of the high point things that are going on behind the curtain with Centerwell. Justin, did you or your team have any questions for me? I think you're still muted, Justin.
Yeah, I jumped ahead of myself. You guys have been around a long time, and as you had mentioned before, you guys are one of the few groups that haven't, fired staff or closed offices. You're actually growing with, like what you said, with the acquisitions. As far as the agents are concerned, you've been around the block. You've seen this business quite a bit. It's open enrollment right now. Maybe certain agents are like, I got a little bit of daylight in a couple weeks after I get through my clients. What are some of the things that they should be doing? What should some of these guys be doing right now, in conjunction with Centerwell or Conviva?
So I can tell you this, and I'm just going to use yesterday as an example, Justin. We were in St. Cloud at Lakefront Park. There had to be 6 to 10,000 people.
Wow.
And we accumulated over 100 leads yesterday at this lakefront. Because it wasn't just for seniors. It was a big. I want to say it was Puerto Rican sort of based as far as like the entertainment came in. It was like a concert. But I will tell you this: during the earlier hours, there must have been, that's when the seniors were coming out. And then I think the crowd got considerably younger as the night moved on and the concert started. But yes, we had close to 100 leads. Now, we did not have a broker partner during this. So our permission to contact has, all the information about, do you want to come in to tour? But it also says, are you comfortable with your health plan, and would you like to be consulted? So if somebody's working hand in hand with one of our community engagement professionals, then why wouldn't they potentially say, hey, this person has a question, or maybe they're turning 65 in 6 months and would like to, meet with an insurance expert. And that's what I consider your people to be, insurance experts, so that they can go over maybe their existing plan versus what's happening in 2025. And then also if they're going to T65, so they can go soup to nuts on like a Medicare 101. So those are ways that we can partner with your folks if they reach out to one of our community engagement professionals. And of our community engagement professionals, Justin, I want to say 9 of the 10 worked that event yesterday, including yours truly, was out there, attending the event. Just, it was a sea of people. And, it's like anything, you do law large numbers, right? There's probably 2,000-3,000 people there, and we got 100 to 110 leads out of it.
Amazing. So moral of the story is be best friends with your reps, and you'll get fed. And I'm telling these guys this day in and day out, because I'm living proof of that. I was a marketing rep at Family Physicians Group, which was purchased by Centerwell. And that's what I used to do. I used to have certain agents that were responsive and were there when I needed them and were willing to work the events when I worked the events. And those were the ones that got leads for me. And as coming from your side, I don't know how you feel about this, but it seems like each rep can really have 3 or 4 different agents to work with. But any more than that, it doesn't seem like it's there. So if your reps, like you just said, you're going to be hiring some new people, and they're going to need to, create relationships with brokers. This is, everyone on this call, this is your opportunity to get in front of people that are there. It's your job to go look for leads for you. I mean, I don't know how else to say that, Yeah.
And Justin, and to what you're saying, if you believe in the law of reciprocity, right? So my people are out seeing these people. Potentially, not every lead converts. You and I both know that, but it's an opportunity, right? It's an opportunity for a potential sale. So in good faith, if we're going ahead and reaching out and, letting you guys do a review for these folks, then we would obviously like them to wind up in a Centerwell clinic doing a tour and being enrolled in the clinic. So that's just the way the law of reciprocity works. And that's the way our people want to see it.
Sorry, might have had somebody
That's
on mute. So there's a question in the chat there about the marketing partnership and your coordination program. And I know you and I have to kind of work out some kinks that we've run into.
Yes, we do.
So we don't have all the answers, but the question is it still active? And, is that program going to continue into 2025?
It is still active. It is going to continue. And just through my discussions with Sergio and with Nick, and I think this came from you, so you can correct me if I'm wrong, what we're going to try to implement, and again, you can cut me off here, Justin, if I'm out of bounds, okay? But I think what we're going to try to do is your sub-agencies, we want to contract direct, and then your people that are in your direct upline, we have to do a roster through the contract that you already have in place. That's the way I understand it from my discussions with Nick and with Sergio, and you can correct me if I'm wrong.
Yeah, I think so. And there's some outliers there that we just have to, ensure, like, for instance, with Riz, she started an agency and I don't think your team knew that. So that's, there's, she's going to be a sub agency. So that has to be set up and we're okay with that. So yeah, to answer the question, our agency partners, we would like you to talk to Brian and his team about getting set up directly. And then our direct agencies or agents, our HPM agents, just see Nick or Sergio or send us an email to support@askhpm.com and we'll get you set up on the program. If anyone reaches out and you're with an agency partner, we're just going to direct you back to them, but we'll help you get set up, we'll help you get trained, we'll help you connect with the Centerwell folks on all of this. And then the payment is where it may differ. So you would go through your agency for the payment now. So essentially that's where we were getting our things mixed up. So.
Yep. And I apologize for any confusion it has caused, Justin. We're kind of working the kinks out ourselves on this side, especially, now we have the big green machine who owns us, and we have to kind of work inside of that, those parameters as well. So we're still working the kinks out a little bit ourselves, but at the end of the day, we're guided by what's right, and making sure that if somebody was placed, we do reviews all the time. If somebody was placed, to try to circle back and make sure that they call it technically a scheduling fee is sent to that particular agent or agency.
Exactly. So the amounts may differ depending on your setup with your agency. So we're not going to talk about the exact amount, but essentially, if you find a member that's a good fit for Centerwell, whether you enroll them in a plan and place them with Centerwell, or maybe they're one of your clients that just is looking for a new doctor and you place them with Centerwell, if you send that business in, you'll be compensated by Centerwell for setting up their first appointment. Is that correct?
That is correct. And so so your folks kind of, they have to do the attestation, which that's something that we actually lost Jose Aguayo recently. He semi-pseudo retired. I still see him in the Medicare market, but I think he's doing less and he's doing it on his own schedule. So they have to do the attestation. They have to submit a roster. And so if you're an agency, we would do it directly through your agency and get them attested. And then if people from your organization, the direct upline to you, Justin, you would just get us their email. They can be attested. And then once they've been sufficiently attested, then they're qualified for it's the Aging Care Coordination Program. And what that entitles, because it's a scheduling fee, so try to make sure I'm thorough on this, is they would have to go through the website, and we'll also get to Sergio and to Nick some of the cards that have our directory. And on the directory, on the website, there's something for agents where it's a schedule your client form, and that gets all the information. And they can go onto the website now and go in the agent portal and schedule your client form. When they successfully do that and schedule the client's first visit, which actually goes into our ECW program, and they can see the slots that are available for new patients, and they can do it as they're front facing with their client to go ahead and schedule them at a Centerwell clinic. So that, and again, that's on the website. It's for agents and it's form.
Okay. So I know that you've got some new updates on the training and how everybody gets started. So what we'll do is we'll ask for you to send that over, and then we're going to build out a page inside of our portal system. So agents go ahead and click it, learn about the program and get started right away from our agent portal. So if you could help us build out that page, if you've got, training decks or videos or anything that they need, that attestation could be baked into, we could work on that to automate as much as we can to make sure that, we get everybody plugged into the program.
So absolutely, Justin. We have some PDFs that we'll send over that are training. I think there's 5 slides that are on the training, how to schedule your client. And then there's also a few PDFs slides on the attestation process. So we can absolutely get those over to you guys, so it helps you build it out on your platform.
Absolutely. Cool. Awesome. Brian, thank you very much for your time. Sorry for about the confusion there. But you held your own, man. You found it.
That's what we call rallying
That's
back. Exactly. So it's good to
That's
see you, Justin, and I appreciate your organization. I appreciate the time that you've given us to participate in the meeting, and we thank you very, very much. And let's keep it going. And I wish you guys nothing but tremendous success during AEP.
We appreciate you, Brian. Thank you very much for your time as well.
All right, thanks,
If anyone is interested in participating in Centerwell's agent care coordination program, just shoot us over an email at support@askhpm.com. And then as we build this page, we'll make sure that we get you back the information. But we don't want to delay the process. So if you're interested in getting started, send us an email over to support@askhpm.com, and we will get you all hooked up with the good news there. So with that,
Justin, before I disappear, I'm going to put my my contact, my direct contact in the chat for your people as well. Okay.
Yeah, very much. Please do.
All right. Thanks.
Yep, you got it. So while Brian's doing that, I just want to thank everyone for being on the call today. If you do need to contact Centerwell, Brian's going to plug his information into the chat there, and you can snap that up and reach out to him directly. If not, we have the basics of the program and how to get connected and set up. Again, email support@askhpm.com, and we will make sure that we get you ready to go on that particular program as well. So just some extra dollars that you can earn from helping the community out, connecting Centerwell, helping them grow, and them help you grow your book of business. So with that, that's the end of class today. Thank you guys for being on the call. We really appreciate you. And until next Monday, good luck and happy selling. Take care.